organizations. As you all know, a lot of the things that are occurring in pharmacy right now between provider status and emerging value-based care models hinges on these advocacy groups and a lot of the regulatory and legislative changes where these national organizations play a really pivotal role. So we met with 4 different pharmacy organizations: APHA, ASHP, AMCP, and PQA, to go over their strategic priorities over the course of the next 12 months and work to advocate on some of the things that are important to us, which is exactly those two same things. So provider status and the emergence of these value-based care models. It was really great to hear that they are 100% on the same page and on board and advocating for these issues every day with legislators and allocating resources for educational things to actually implement these models. So it was really exciting being at the table and conversating with these guys, and really felt like we went to them as a delegation, as the technology vendors that were really trying to get some of these efforts off of the ground. So really reinvigorating meeting in Washington, D.C. You can see a couple of photos over there to the left, the leftmost one being at APHA. Then you have our loyal leader, Sam, in the middle there, also at APHA, and there to the right, the other folks that were at the AMCP meeting, along with one of our mentors and a mentor of ours, both for DocStation and in a past life, whenever I was affiliated with the health system, Harold Godwin, off to the right there. So that was an incredible meeting, and we hope to kind of continue those conversations and advocacy efforts with those organizations here in the future. So segueing over to the program side of the house. So our community of programs and pharmacies participating in programs continues to grow. So every year or a couple of times a year, we're bringing on new programs to the platform. A couple of the different ones that we're really proud of and excited to continue are our partnership with Blue Cross Minnesota. CPSN has been a really great partner of ours, which really spans nationally. So CPSN being the organization that's doing a lot of the same work and facilitating these contracts for payers and using our tool to really enable this work. Moving on to Devoted and North Dakota Medicaid, Forward Health, the North Dakota One program, West Virginia One, each really important partners of ours, and most recently the Blue Cross Blue Shield Michigan program launching in Michigan with a couple of really important partners, Michelle and Meyer being one of those, and Hometown Pharmacy coming on here relatively soon. So we're really excited about that one, not only in it being in kind of a new geography, but really the innovation that it brings to the pharmacy space and the things that we're trying to potentiate in terms of outcomes for patients in Michigan. So that one we're really proud of. So getting into the weeds, program by program here. So starting with Blue Cross Michigan, again, one of our newer programs. 2 partners really important to that one, Meyer and Hometown, running this value-based care model. This program is focused on a huge number of different metrics. So there's 11 different quality metrics that we're focused on for this program, the most that we've ever done. The most that I'm aware of is kind of has occurred in general in terms of a scaled pharmacy program. So this one is focused on adherence, statin use, COPD, post-discharge exacerbations, or post-exacerbation discharge, and making sure that patients are on the right medications, proper asthma medication use, and high-risk opioid use. So there's 2 different metrics and a couple of different ones that kind of umbrella up to these different categories. So what we're doing is targeting members who have risk factors and presenting those opportunities to pharmacies who are within that network, so they can document and close those gaps in care, and in turn be dispersed incentives for that work. So the goal is obviously to improve those quality metrics. It's really exciting to have this net new work and revenue opportunity for things that pharmacy was really trained to do. And again, using this as kind of a model for these quality programs as we expand out to other geographies and then into other lines of business. I'm really excited for what comes out of this one. We can go to the next one, Aubrey. Next, we'll talk about Blue Cross Minnesota. So this is being one of our first programs. We've been working with Blue Cross Minnesota since 2018, and we continue to work with them. We're right now, we're kind of scoping out different updates to the program for 2023. So stay tuned for some more details there. There won't be a ton of huge changes, some definite positive changes in reimbursement that we'll bring to you here soon. That one will continue to be focused on adherence and statin use in persons with diabetes, with a per task reimbursement of $20. So one of the things that we brought the last time to Pharmacy Innovators is really looking at the performance of this program. So Blue Cross Minnesota being a dual eligible Medicare, Medicaid program, they're the sickest of the sick patients. So if we look at what we've been able to achieve for adherence metrics and also for statin use, it's really incredible. So we're sitting here in August and we see a trend moving. The trend for adherence always moves down and to the right. So you end up at the year typically at your lowest point, but being right now at 94% for those different adherence metrics for this really challenging patient population is really nothing short of miraculous. It's really incredible and a really huge improvement of what has occurred in that program in years past. Similarly with statin use in persons with diabetes, that one really at the beginning of the year, it starts low. And as more and more patients start on a statin and pharmacies have conversations with patients to get them on a statin if it's warranted, sitting at 87% right now. So that's trending towards being at the 5-star goal for CMS. So really great work that's being done for that program. We're excited to continue that one for 2023. Moving right along to Devoted Health. So Devoted Health being a Medicare Advantage plan. This one spanned out across a couple more states than our previous ones. Florida, Texas, Arizona, and Ohio. Again, one of those programs that we're focusing on a whole number of different quality metrics, not quite as many as the Blue Cross Michigan program, but still a ton. Adherence, SUPD, and CMRs, and others. So at the beginning of this year, we expanded into 2 new territories, Florida and Texas, and added 4 new tasks related to care coordination around preventative health screenings and osteoporosis med management. And we also made an update on payments to make sure that pharmacies were properly incentivized for every intervention that they perform. So one of the things that's really important to us is listening and getting feedback on how models are structured and then implementing that in future years. So if there's things that are currently occurring in your program where you're like, dang, I really wish that would improve, you always have our ear, and we will advocate for you and thus for pharmacy. Similarly, if you want to go back just for 1 second there, Aubrey, sorry.
No problem.
In terms of performance, again, sitting at right around 94% for performance on this program, being a Medicare Advantage plan, looking really, really good, trending for 5 stars for those 3 adherence metrics, and very similarly for statin use and diabetes, trending towards 5 stars to end the year. And now I can move on. Sorry, I paused.
No problem.
Moving on west to North Dakota 1. So again, North Dakota 1, we've been working with them for some time now in the state of North Dakota. This being an opioid program, so we're continuing to see consistent engagement and engagement with patients in the state of North Dakota to assess them for needs of naloxone and disposal kits so they can safely take opioid medications. So we're seeing some really good engagement there. Earlier this year, I think actually at the end of last year, we added a follow-up task there focused specifically for follow-ups for technicians to make sure after new opioid medication, whether or not that's still warranted after 3 days and how pain management is going and whether disposal kits have been used. So that program continues into 2023. We're excited to continue our partnership with North Dakota 1 program. And then moving on east to West Virginia, this program almost the exact same. So North Dakota was such a model for great care in their design of the North Dakota One program that word really traveled. So West Virginia was one of the states that where the opioid epidemic was a real thing, and through state opioid relief funds we were able to stand up a program very similar to the one in North Dakota. So you'll see a lot of similarity between those two things, those two programs, having an initial screening and a follow-up screening with a goal of providing more naloxone to patients and disposal kits so they can safely use opioids. And finally, I just wanted to zooming really out. So I started the presentation today discussing our advocacy efforts and our meetings in Washington with those 4 different pharmacy trade organizations. Medical billing is really a huge topic of conversation as of late and as of the last kind of 5 years or so. So really what we're doing is trying to keep apprised to all the changes in legislation and regulatory things and different initiatives that plans have in these states for payment to pharmacies for services. We're seeing a lot of that that is occurring through the medical benefit, through submission of medical claims. And as a product of that, we're trying to build out features and functionality to support those exact things. Through scheduling and messaging, you'll see some of those exciting new features that we're bringing to you on here today. But really where it starts is our intimate understanding of what's going on in the states through regulatory and legislative things. And we're keeping a really tight list of these changes here. And but we really rely on our users and our friends on bringing updates, because they're the boots on the ground. They often hear things before we do. So if there's things out there that you're aware of, there are payment opportunities that you want to take advantage and use DocStation for, please let us know, and we're happy to support you in whatever way we can. But we're looking at this map constantly and trying to find ways to bring you value through our platform. And you'll hear a little bit more about that from my friends and colleagues at DocStation here in just one sec.
Excellent. Yeah, but before we go beyond this slide here, I wanted to circle back on that as well. Just back channeling a little bit in the chat with John Daniel. Medical billing is, it's something that's really exciting and newer-ish in the world of pharmacy, but it's complicated and difficult to do and kind of get up and running. And so DocStation's really taken pride in understanding the ins and outs of how this works and making it easier for you as a pharmacist to actually recoup revenue from doing medical billing. So, so John just mentioned, he's using Cardinal Medical Billing, FDS for medical billing. That's great. There are lots of different vendors who do a little bit of this or a little bit of that in the medical billing space. And one of the things that that we pride ourselves on, as Max said, we're listening to feedback, doing our best to make sure that the platform, DocStation, does everything that it needs to, but in a way that is easy for you to implement into workflow. And in addition to that, we have a rock star support staff, people who know medical billing state by state, payer by payer, inside and outside, and are able to make sure that not only are your claims going through, that they're getting paid more frequently, that if they need follow-up, that we're closing the loop on that more frequently, and that we're maximizing your revenue opportunity for each one of those individual claims as well. So yeah, it's a great thing that we're really proud of, that we continue to expand and are continually committed to making sure that that's nice and easy for our users. Awesome. All right. Well, then I'll just keep on talking, Max. And we'll jump right into our product updates. So many of you have probably seen new news, just even in the last 2 weeks, from DocStation's CEO about a couple of these things that I'm going to drop for you. But we're really excited to announce DocStation Premium subscription. So we have a variety of feature packages now that will suit a variety of pharmacy practices. And we're still going to continue to maintain that tight feedback loop. We're listening to our users, and we are building value into the platform based on what you have described as your needs. So we're really proud of that and excited to be able to announce these new subscriptions. So there's a little bit of a breakdown here between essentials and premium. So our essentials plan, which includes that medical billing that we've just described, as well as concierge support for that. Is live support for managing those claims and watching those go through. And then our premium subscription, where we're adding significant functionality, development cycle over development cycle here. And so we're thrilled to be able to continue adding to these packages here to really make DocStation, as it is, the ideal tool for managing your clinical practice. So we've got some additional information here you can learn. Of course, I am recording this session, and we'll go ahead and send out the slide deck afterward. You'll be able to kind of click through those links if you haven't had a chance to review them in your inbox in the last couple of weeks. Something we're, like I said, very excited to expand upon. And another announcement that we made just earlier this week as well is an additional product that you can package along with the software package, and that's enrollment and credentialing. So just as we've talked about before, and Max really started this presentation with that, the indication of provider status, and that's really spreading across the states. It's really exciting, and we're finding that a lot of our users are like, okay, well, now what though? I mean, I can do this thing, but now what do I do? And we have all of the help that you need by way of our enrollment and credentialing package. So we're very excited to offer this as truly a white glove service to enable you to get through the credentialing and enrollment process with health plans so that you can be recognized as a provider and earn revenue based on that contract. We are working with a partner called MedTrainer, who specializes in credentialing for pharmacist providers here, and really has a great track record of reducing the friction and the amount of time it takes to get from sort of initially signing those papers to billing your first claim. So we're really excited about this. Again, click a link here to learn more about the product. But at a high level, if you have interest in utilizing this package or purchasing this package, it comes along with the DocStation Premium subscription. So in purchasing that DocStation Premium subscription, you will then gain access to a significant discount with our partner MedTrainer on credentialing. And so that is a really great way that we have to make sure that you have all of the tools that you need as you start using DocStation's platform to bill those claims and make sure that you're earning reimbursement for your clinical practice. And then another thing that you may have recently seen is some additional functionality to our calendar. So last time we met, we had some high-level basic calendar functionality in beta testing. All of that went very smoothly, and I've got some really great feedback that we were able then to work into the product now. So what we've got here, and you can see a couple screenshots here, is we have added functionality for scheduling to our calendar as part of our premium subscription, which enables you to create your own appointment types and embed a shareable link for patients to actually be able to find you from either your website or from a Facebook page and be able to schedule their own visit on your calendar. So it's a great way to really open up your practice in a more visible and public way. A lot of this came from a lot of feedback that we had gotten about the process of identifying a patient who's eligible for a service and then contacting the patient and then scheduling that patient and following up with them, making sure they attend the appointment, kind of all of those things. And really, this is a great step in the direction of being able to help to let a patient who is very capable on their mobile device of kind of working with you in that way and really simplify that process and make your workflow significantly more efficient. So we're really excited about this. Again, this functionality comes along with the premium subscription, where you can, again, edit appointment types and then share links to those appointment types to allow patients or anyone on the web, maybe new patients, new business for you to find you and the services that you make available in your clinical practice. And hand in hand with that, we have also released a patient messaging feature. This is SMS secure messaging, which enables not only appointment reminders for patients, but also for you to reach out ad hoc on demand to any one of your patients with an enabled mobile device. So this is a great way to maybe inform them of something very quick that they need to know. Hey, remember to bring your medication list to our appointment upcoming, or One instance that we actually saw in use with a pharmacy here in Minnesota is there's significant construction in the area. Please be aware, park over on this side of the building. These kinds of things that are important for patients to know, all the way down to birthday wishes, anniversary wishes, whatever the case may be. It's a great way to stay in contact with your patient. And ultimately, as you know firsthand, it's sometimes then even easier to connect with them via text message than it is on the phone or even in person. So this is another one of these exciting features that we're excited to announce has recently launched for our users on the premium package. And then the last thing that I wanted to mention in the way of product updates, we're getting close to our time here and I want to be respectful of that, is that we do have a brand new Help Center article in Intercom for our release notes. It's entitled the Changelog and Release Notes article. So what we're doing here is just on a pretty regular basis, anytime that we are shipping any new development or things that will change according to you in the UI for what you'll see there, we've just got a little bit of a little note here. And so sometimes this will lead to an even larger Help Center article that explains additional functionality. Sometimes it's just a heads up of saying, hey, there's this new little filter here and it does X, Y, and Z thing for you. So this is a great place to return to favorite in your browser as an article to come back to and make sure that you're staying up to date in between all of these pharmacy innovator meetings. So this is what I wanted to share in terms of our product updates here. And I'm just looking over my notes here. So I see John is chatting with, it looks like just me, direct message in the chat, which is great, but that means I can't get support from Max and Rachel of my helpers over here. So John, I'm looking at some of your questions here, and I think it'd be really great to have you chat with Max. He'll have a little bit more information about the credentialing, including fraud, waste, and abuse, and sort of what we're going to continue to expand there in terms of the credentialing feature, as well as our return on investment. You did ask a great question that I want to share with the group here, though. Will the beta users no longer have access to these things? Indeed, beta users will continue to have access the same way that folks will have access on our essential and legacy packages as well. So what you have currently, you will continue to see access to. What changes is these additional features that we're building in. So you will see some functionality in Calendar that is still available to you before you're on the premium subscription. And then as you launch into the premium subscription, a number of those things will open up wide for you. So that's a great question. Thank you for bringing that up. That does remind me that I can mention, for those of you who are new, we do have a beta pharmacy group. So if you are interested in being able to collaborate with us a little bit closer on the product team to gain access to new features sooner, be able to help test and give feedback, and really have a visible and direct impact on the platform, please just let us know. Reach out and chat either here in the meeting or as you're running around on the DocStation platform there, a little blue chat bubble in the bottom right corner. Let us know if you are interested in joining the beta group, and we'll get you in for that. Awesome, Kevin. I see you. All right. So in closing here, this is just a quick reminder. We know that pharmacy is a small world. If you know of other folks who would benefit from the awesome features and functionality on DocStation, please send them our way at docstation.co or connect with us via support@docstation.co. Again, want to thank you all for your time, for being here. And we just have a couple more minutes on the calendar here. Does anybody have any questions for myself, Max, or any of the rest of the DocStation team? Excellent. All right. Well, really appreciate you guys being here. Again, we could not do this without you and without your feedback. We're very thankful to partner with each and every one of you. So we'll see you next time, and enjoy the rest of your afternoon. Thanks.
Thanks, Aubrey.